NHS England show that, astonishingly, nearly a quarter of the 88,000 people in NHS beds are medically fit and don't need to be there. They're also, crucially, outnumbering coronavirus patients. Maybe this is the new variant, bed blockers. But anyway, the Chief Executive of NHS Providers, Chris Hopson, who called this weekend for a return to masks and social distancing, grief, but he's fun at parties, said current pressures on the health service are a serious worry. He warned that a major contributory factor was the inability to promptly discharge 20,000 bed blockers who are there simply because they do not have anywhere to go. That number has approximately doubled since December and is 5,000 more than those in hospital with COVID. Hopson admitted the NHS have been finding it difficult to keep on top of discharge and flow. Well, Karol joins us now. Yes, great to have you on the show. Thank you very much for joining us. Another case of our national COVID service unable to cope with anything else? Or actually, is this in fact not their fault? Talk me through it.
It's got a huge, complicated demographic, this. Bed blockers were around when I was first a consultant 40 years ago, and they'll always be around. Bed blockers are a pejorative term. We don't like people being called bed blockers. It's not their fault. That's the problem. Social care has gone down. Family structures in Britain are much weaker than they were 40 years ago. So people don't have granny annexes. They don't look after granny or grandpa. And the predominant category of bed blocker is someone over 75 that has complex, multiple medical conditions. Some of them will have COVID. Some of the 20,000 people in hospital, so-called with COVID, are part of the bed blocking problem. I mean, this is typical how the NHS thinks about it, as though it's someone else's problem. It's their problem. We've got to get into a mindset that allows hospital care in very expensive beds, most hospitals £500 a night, and then step-down care, not care homes where you get no medical care, but something halfway house. And people have toyed with this idea and actually got nowhere. That's the problem.